everyone. I am so happy to see all of you all here. I am Reverend Jermaine Alberty, the Executive Director of Pathways to Promise. And we have with us Reverend Barbara Meyers, who is a friend of Pathways and our guest speaker for our Engage, Learn, and Network Leadership Forum. Pathways to Promise has been around since 1988, and we have been connecting mental health, faith, and culture for a long time. And we're so excited in these leadership forums to have an opportunity to not only hear from guest speakers, but at the end to hear from you and what you're doing around the country. Typically, we allow about 30 to 40 minutes for our presenters to speak and do Q&A. And then we set aside the last 15 to 20 minutes, as I said, to hear from you. Today, we'll hear from Reverend Meyers, who's going to talk about from her book, Held, Showing Up for Each Other, Mental Health. I am so excited to introduce Reverend Meyers to you. She's a community minister and mental health advocate. And she really shows us in her book how members of liberal religious congregations can be supportive to those living with mental health problems and their loved ones in their congregations and society at large. Reverend Meyers is a Unitarian Universalist community minister with a mental health ministry based in Fremont, California. She's also the assistant director of Life Reaching Across to Life Peer Support Center, and she's the author of a mental health curriculum for congregations. And once again, the book she's going to be sharing with us today, Held, Showing Up for Each Other's Mental Health. So we are so excited to have Reverend Meyers here. And she's also the president of the UU Mental Health Network. Reverend Meyers, I'm going to turn the floor to you. Once again, thank you so much for joining us. We look forward to hearing your presentation.
Well, thank you very much. I'm happy to be here to talk to you about my book. So I'm going to go into my presentation here. Oh, I have to, let's see. There we go, started. Okay. So the title of the book that I've written, and it was published last year, is Held, Showing Up for Each Other's Mental Health. And it's meant for every member of the congregation, and things that they can do to be helpful to folks that have mental health issues in their congregation. That's the audience. And it has a study guide in it so that congregations can use it as a, sort of a book read and a study guide in their congregations. So I'll start with a story. A lot of this, the book is motivated by stories that I had from my ministry. There is a woman who whose daughter was seriously mentally ill and in a psychiatric ward because of a bad episode. And she and her husband, they were members of Unitarian Universalist congregation, and her husband were going home after work and rushing off to visit their daughter every evening. And they had a call from somebody who was in the congregation, and they said, "We're trying to help out a family who's had a member of their congregation, a member of their family is being hospitalized, and we're trying to help out and bring casseroles over to their house when so that the family won't have to be worried about fixing something to eat. Would it be possible for you to fix a casserole for this family that problem?" And they thought, "Oh yes, we want to help out." So they, put themselves together and fixed a casserole and took it over to this other person's house. And then they went off to visit their daughter in the mental health ward. And when they were driving home, the woman said she thought, "Wait a minute, we have a family that's in member that's in the hospital, nobody's bringing us casseroles. Is there a double standard here? And the answer is yes, there is a double standard. The people that are in the hospital because of a mental health problem, and probably the same thing happens when somebody is in rehab for addiction, nobody runs over to their house with casseroles to help them out. And this could be, you know, maybe because they didn't tell anybody that there were somebody in their family that was having this kind of illness, or it could be that people know about it and they just figure that they don't want to acknowledge it for some reason, and that they're going to just sort of ignore it. And if you think of anything that you want to learn from this presentation, is the no casserole disease needs to stop. So, and a lot of you probably already know some of these things, but there's one in 5 American adults each year is diagnosed with a mental health problem. And nearly half of these coexist with addiction as well. In fact, it's worse since the pandemic. I've heard numbers like 1 in 4 adults now that are having problems because of the pandemic makes things worse. So any Sunday, you can be sure that the pews or Zoom screens, if you're doing by Zoom, or however you're doing it remotely these days, are filled with people that are living with mental health problems and their loved ones. And many of them are suffering silently and just coming to church to get hope to make it through the week. But nobody knows what they're living with. Talk a little bit about what mental health recovery is. It's a process of change in which people improve their mental health and wellness. They live a self-directed life and they strive to live to their full potential. And this definition comes from the Substance Abuse and Mental Health Services Agency of the US government. And for many years, people were told that mental health problems people don't recover from mental health problems. And this new approach about looking at recovery is a way of acknowledging, yes, people can improve their mental health and wellness and can make decisions for themselves about what to do with their lives and can live to whatever they want in their full potential. It doesn't necessarily mean the absence of symptoms or the absence of a need for medications, but people can recover. In fact, I think of myself as someone that sometimes has symptoms and sometimes need medications myself. So I'll tell you a little bit about my story. That's a picture of me in 1978 with my 10-day-old daughter, Carol. I had shortly after that picture was taken, a postpartum depression, a very serious one in which I became suicidal, and I was hospitalized because of how serious it was. And it was a very troubling and shattering in many ways experience for me to be in the hospital with people like those other people that were there with me in the hospital. I didn't thought there was something wrong with me, that I was damaged as a human being. And I was very deeply unhappy with my own circumstance for many years after that, even though I was one of the lucky ones who, responded to medication fairly well and psychotherapy fairly well. And I was able to get back to a normal way of living, but still deep in down, I was very disturbed about my own situation. It wasn't until a number of years, in fact, 8 years later, that I re-examined my life and said, I simply don't want to live like this anymore, thinking the way that I am. And I went back to my psychiatrist and said that I wanted to really explore what was underneath all of this and make any changes in my life that were necessary so that I would be so miserable. And one of the things that he did when he was talking to me, we went into this exploratory psychotherapy, was he asked me, what are you doing for yourself spiritually? And I said, nothing, because at that time I hadn't been to church in many years. I wasn't doing anything. And so he said, would you like to learn how to meditate? And the first thought that came through my mind when he said that was, what, what is sitting around and doing nothing? What is that going to do? What kind of, how could that possibly help anything? But I had promised myself that I was going to do whatever he suggested because I really wanted to make changes. So he gave me this little book about meditation and practiced it a little bit in his office. And then I went home and I would sit for maybe 10 minutes or 15 minutes or something. And it was literally the only time in my life that I wasn't rushing from one thing to the next. And after about 2 or 3 weeks, I went back to see my doctor and I told him, I don't know where it came from, but I'm happy. And I'll never forget what he said. He pointed at me and he said, it came from you. And it was like a whole different way of looking at the world. And I realized in that moment when he said that, he's right. There is something precious and unique and holy and sacred that is inside of me and in fact inside of all people. And I experienced that, in the process of trying to understand this, I experienced what I would call a rebirth in a way of looking at myself and looking at what was important in my life, looking what I wanted to do with my life. And eventually I ended up changing my entire career. I had been a software engineer working for IBM for 25 years. And I was close to retirement age, and I decided I'm going to take early retirement and go to seminary. And so I went to seminary and became a minister. And the whole purpose of my ministry was to work to help people that had mental health difficulties and help them understand that they were precious and unique and sacred in just the way they were. So that's sort of my story of how I got into this. Some of what I do with my ministry is to try to help congregations understand what they can do in their own congregations to help other people in people that might be struggling with mental health difficulties in their congregations. And one of the main concepts is something that healing is healing the whole person. It isn't just taking these pills and you'll be okay. It's looking at the entire person's life. So not only who they are spiritually, but intellectually, what are they learning? What are they what ideas are they coming across? Physically, how are they taking care of themselves? Eating, sleeping, exercise, that kind of thing. Environmentally, what kind of a place are they living in? How do they get out in the environment sometimes? What do they surround themselves with? Financially, do they have enough resources to live the life that they want to? Occupationally, are they doing something with their life that they think is important? Socially, who are they interfacing with? Who are their friends? What kind of environment socially are they in? Emotionally, how do they understand what is happening with themselves emotionally, and do they understand when they're getting into trouble and how to take evasive action? So it's this entire picture of wellness as it takes to get well. And my message to people in congregations is that people in the congregation can help in those areas that are not covered by mental health services. It can help people spiritually, intellectually, physically, environmentally, help them explore what's important to them occupationally, and certainly socially, having people to be around. And I know this because the people in the church that I joined after I had that spiritual experience were able to help in many of those areas in my life, and they were tremendously healing to me. So a mental health crisis is a spiritual problem as well as a psychiatric one. Many people who go through this, and you probably know this, experience doubts about their own selfhood, that what they see as truth, what they find as meaningful, what love is, and agency. What can they do in their lives themselves? And this experience might undermine whatever they whether their faith is and what the way they view justice in the world, because there are many, it can affect in people spiritually. There was a study that was done, in fact, many studies have now said this, that when people have mental health problems, what is that they do? What is the most helpful thing that they can do? And many of these studies have shown that spiritual practice is the #1 coping skill that people use, which means they pray, or they meditate, or they listen to music, or they engage in some sort of Tai Chi or Qigong, some kind of art like that of the body, chanting, maybe having spiritual direction. So the #1 thing that people use is spiritual practice, and getting people to understand and find a spiritual practice that is helpful to them can be really important in someone's life. I know it was very much for me. So there's a psychiatrist in Long Beach, California, named Dr. Mark Reagans, who did a study about what are the stages that somebody goes through when they get better, when they improve from mental health problems. And he was talking about sort of the stage, kind of like the stages of death and dying, with a similar concept of stages for improving when you're getting better from a mental health problem. And the first stage that he said was hope, the first step in recovery. And that is that somebody has an idea, maybe not exactly what's going to happen, but an idea that things could get better in their lives, and somehow that they're able to internalize that. That's the first way that people can start to believe that they can recover. And sometimes they go through times in their mental health journey where they don't have hope, and we may need to hold it for them if they don't. So I'll tell you a story. This is from my hospitalization in mental health ward, when I was suicidal, and I thought I was just good for nothing, that my family would be better off without me. And my doctor said he could help me, and I thought, well, he just says that to everybody, And there was the second or third day, I think, when I was in the hospital, there was another patient who came into my room and sat down and told me that she had come into the hospital 2 or 3 weeks before, very ill, and she had worked with the doctors and taken medication, and she was now so much better, and she was about ready to be released. And she told me she thought that might be helpful, that it was going to be possible for me to get better too. And when she said that, I thought, wow, maybe there's hope for me. And that was really the start of my recovery, is when somebody told me that, and I was able to think, oh, maybe there's help for me. And it's important, I think, in this story that it was another patient who told me that. It wasn't the doctor. I didn't believe the doctor. And I didn't believe my family when they said I was going to get better. I thought they would be better off without me. That wasn't true, but that's what I was thinking. And it wasn't until somebody else that had been there told me that it was possible to get better that I actually could hear it. So this is one reason why I think that peer support is so incredibly important. So one of the kind of supports that people can give is what I call presence. And that just means being with somebody in someone's presence, actively listening to someone without judgment and validating their feelings, even if you don't agree with their feelings or agree with what they're saying, to at least validate that they are having those feelings, and not giving them any advice, just being there. So presence is a sacred gift. And so I'll tell you the story from when I was an intern minister in a fairly large congregation. I'd been there for maybe 2 weeks, and there was a Sunday morning where all of us were getting ready, bustling around, getting ready for the service. And there was a woman who I knew in the congregation, I'd been introduced to in the congregation. I knew she was very seriously, had very serious problems with anxiety. And she came up to me and she said, "Oh, Barbara, I don't know what to do. I'm just so anxious. I don't know what to do. Please help me. Do something, help me." And I thought, oh my goodness, what is it that I can do? So not knowing what to do, I said, well, why don't you and I go and sit in the library, because I knew there was no one in the library at that time. And so she and I went into the library, and I closed the door, and I sat there holding her hand, not knowing what to do, not knowing what to say, and thinking, oh, what can I do? What can I do? I can't think of anything to tell this person to do. And after a couple of minutes of just sitting there in silence, she turned to me and she said, "I feel so much better just being here with you." What a lesson for me. It was my presence, my caring, my just being there. That was the gift that she needed. She didn't need me to be telling her to do anything. She just needed a caring person who was going to be with her. And that was the most dramatic way of learning that lesson, but I've also learned it a number of other times in my ministry, to realize that just being there. And this is, what I tell folks in congregation in the book that I wrote, is this is something that anybody in the congregation can do. You don't have to be a trained minister to do it. You don't have to be a psychoanalyst or anything. You can just be with someone and give them support. Your physical presence is important. Another thing that I've learned is when I've given talks in congregations about mental health, and I've done this many different times now, what I tell some of my own story, not because I think my own story is so incredibly unique, but because I know it makes it safe for other people to acknowledge it within themselves or within a loved one. So at the end of the service, what I do is I ask people, as an act of public witness, if they or a loved one of theirs is living with a mental health problem, if they could rise in body or spirit. And every time I've done this, it's like 80 to 100% of the people will stand up. And they all look around and they can't believe how many people are standing up. And there are all these folks that have been affected. And it's almost everyone in the congregation that's been affected, and it's certainly the great majority of folks. And it makes it safe. So at coffee hour after the service, they're telling each other stories about, oh, when my sister has bipolar, or I had depression when I was younger, or whatever, it makes it a safe place. And it's the biggest, I'll just leave this with you if you're ever wondering what you can do to get rid of mental health stigma. An act of public witness after a service like this is the most effective thing that I have discovered to help. I've even done a Zoom version of this, now that we're in a pandemic, where I either have a poll or I have people write in the chat, yes or no, if they've been affected by this. And you see all these yeses going, yes, 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 and the last time I did this a couple Sundays ago, it was 100% of the people that said that, and they couldn't believe. Everyone said, "Oh my gosh, I didn't know you had." It was amazing. So, so I just give you a hint: if you're ever doing a service on mental health, try to do something like this, public witness. In the book, I also tell people what helps the individual when they have mental health problems. And it isn't, it's basically collected ideas that I've had in it, of things that actually have helped people. It's not a professional advice or anything, but the categories of things that help individuals are getting professional help or peer help. There are many people who've had bad experiences with professional help, and many times peers can help in those kinds of situations. Learning how to care for their body, getting enough sleep, eating enough, getting exercise, learning how to manage understand their pattern of stress, and how to manage it, being aware of what your emotions are and understanding them, finding some way to enrich your life by learning or creating or doing something creative, and then engaging with your spirituality. All of those things are things that I have, just by working with people, understood what helped. In the book, there are a lot more specific ideas under each of these categories, but those are the basic categories. And then what about the family and loved one? They're suffering too. They also need help. They're suffering in a different way, but they need help. So the kinds of things that have helped them, families are professional or peer help. So getting their own therapy, engaging with peers, which is National Alliance on Mental Illness, or NAMI, is the one that's sort of the premier mental health organization, and they have a program for family, what they call family to family, where families who have gone through difficult times can help other families out. You can learn how to communicate effectively with your loved one, help them live with their situation if they need help getting to doctor's appointments or getting medications or whatever, to help them in a way that they can live with their situation. And finally, don't let it take over your life. Have a life of your own. Mental health is a social justice issue, and it's social justice because it's hard to get adequate and quality mental health care for many people in our society. A big factor is insurance, whether insurance will cover something, whether it even exists in your area, whether your practitioners in your area even take insurance, or is it so expensive that you can't afford it, There's a lack of wide availability in mental health treatment. So sometimes insurance companies will say, okay, these are the following practitioners in your area that are authorized for our insurance. and people will call every one of them, and there's no appointments within, a couple of months, of when they call. I've heard that story many times. And then alternative therapies, which can be very helpful for some people, sometimes are too costly or not available in a certain area. So it can be really hard to get good mental health care. There are cultural, linguistic, or geographic issues. It's hard to find practitioners that are Black, Indigenous, or people of color, or people that are friendly to those audiences. LGBTQ, practitioners that are friendly to gay and lesbian folks, people that work with teens, people that, if you don't speak English, it may be hard to find mental health care. And then also, a really big issue, involvement in the criminal justice system. The jails and prisons are full of people. I mean, I was in a call just a couple of days ago with our County Board of Supervisors. There's 40% of the people in our county jail have mental health issues, 40%. And they're trying to build a bigger jail so that they can hold all those people. And, the group that I was with was trying to say, care first, jail second. So I think they heard us, but we'll see. We'll have to stick with it. So there's lots of people that are getting psychiatric meds that are in jail and not getting the best of care. It can, very few people go into jail or come out of jail with a better mental health condition than they went in. And then also engagement with police can be really, it can go not very well sometimes. Sometimes even people are tragically killed. And I know a couple of instances where people that I know personally that they've called for the police because their loved one was in a psychiatric crisis, and the police have come and ended up killing their loved one. Just really, really horrible things that happen. So, getting some way to engage with social justice around that issue is really important. And it's really sad to say that often the most troubled people get the worst care because they're the ones that have the least amount of money and that have had maybe more engagement with the criminal justice system. So any of these issues, if you want to work on social justice for mental health, get involved in trying to help out. I don't want to leave a completely hopeless issue. There are some good low-cost options. There are many fine peer and self-help groups are free. The place that I work for, called the Alameda County Network of Mental Health Clients, is free to people that come because we get our funding from the county. Some local governments have social services that are free or on a sliding scale. There are places that people can get support online. I know our local NAMI, they have a support group for consumers that meets every week online. And then some of those things that I listed for what helps the individual don't have a cost associated with them. So that's my book, and it has a study guide, and my fondest wish is that people will take the book and have book reads in their congregations and then figure out what they want to do as congregants. So I'm going to stop right here and let you ask any questions that you might have.
I would like to say thank you. Thank you so much for sharing your story. And sharing what you shared was just a lot of wealth of information that many of us can take away, and not only just for ourselves, but even for some loved ones or friends and family that we know of that could really benefit from this information. And I love how you talked about, taking care of yourself, because sometimes we get so caught up in wanting to, I guess, save the day, or just be that presence for someone, to where sometimes that, I would call it, that compassion fatigue really becomes
Right.
overwhelming. So thank you for sharing just ways of how we can take care of ourselves too.
Oh, thank you, Cody. Are there any other
Barbara,
questions?
this is Robert. I was curious, one thing I liked about what you said about your book is that it has a study guide. So, that sort of suggests that a group in the congregation with an interest in this area could sit down and study the book and discuss and maybe come up with ideas for how
Right.
to do things in their own local congregation. Do you have any thoughts about, the congregations are juggling so many priorities? Well, we need a program for this, for that, for this, for social justice issues, all kinds. Any thoughts about how to make this a high enough priority in a congregation as it deserves to be?
That's a really good question. I think, well, certainly the public witness, where everybody can see that everyone is affected by this. So I can't say it's not important, because they can see that everybody is affected. That's a sort of a first step. And really, it almost has to start with some group of committed folks that are going to make this their issue, and be willing to, take the lead on running the study guide, or talking with the board. And it almost has to start with a group. There's a number of things that I didn't talk about that are in the book, but there's a sort of a stepwise guide for creating a mental health ministry in the congregation. And you sort of start by getting the support of the minister and the lay leadership, because if you're off in a corner doing something and nobody knows about it, then you're not really going to be affecting the life in the congregation. So, I guess it would start with, finding a core of, 3 or 4 people or something that can say, we're going to take this on, and we'll talk to the minister and the lay leadership about this, and, get their support. It's sort of a necessary first step. And then you move from doing some kind of education in the congregation about it, maybe having a service that focuses on it. I think that's a lot of times that's where it starts, with having a service that focuses on mental health, and then getting everybody to publicly admit that it affects them, and then maybe having you could do it, you could make it around one of the mental health month or something, make it be a focus for that month, or a focus for part of that month, or there's a mental health week, I think in October, that a number of congregations do things around mental health week as well. So forming a group, getting the support of the lay and professional ministers, and then doing a service, and then seeing what kind of interest there is in the congregation beyond that to do things.
Thank you.
Yeah.
I'd like to share what Miss Stephanie Gray just posted. She said, very good presentation. Faith-based organizations all need mental health policies and ministries to connect many with resources, form support groups, and conduct educational and awareness seminars, health fairs, and events. This will help reduce stigma. The church must be the hospital for all illnesses. Thank you for sharing that, Stephanie.
Very good. Yeah, I see that. Okay.
I was struck too by your comment about how being present to a person, not necessarily having to give advice or do anything,
Yeah.
is so powerful. And it reminds me of the Pathways to Promise emphasis on companionship and just being there for people
Right.
as they do their journey in life.
Yeah. Yeah. I talk about that in the book too, about the companionship program. And, that a lot of times people say, well, if there's somebody in our congregation that, what if they stand up and they're in the middle of the service and disrupt everything? And, then what do we do about somebody like that? And a lot of times in the past, what congregation has done is kick people like that out, and the companionship model says, no, we find someone to sit with that person. And if the person can't be with the rest of the congregation during the service, then that person could take them out and be present with them outside and show that they have a friend, and they're not getting rid of someone, you're taking care of someone when you do something like that, because it's not doing them any favors by, letting them disrupt things and getting them thrown out.
Yeah.
Not doing it. It's not good for either party in that case.
Thank you.
Thanks, Robert.
I think we can't hear you, Mr. Gregg. I think you're speaking. Oh, there you go.
Because, yeah, I do this all the time. Sorry.
No, you're
Okay.
Is the Kindle version have the study guide? Is it complete?
Yes. Kindle version does have a study guide. The whole thing, the entire book is there. When we read it in my church, we did, let's see, I think 2 chapters a week, and we did in 4 weeks. So there were 8 chapters, I think, in the book. Let's see, I don't remember. 1, 2, 3, 4, 5, 6. Yeah. Yeah, we did 8 chapters. We did 2 chapters a week, and there's 30 questions after each chapter, so that, to initiate discussion about chapter, and that worked fairly well.
How long were the discussions? An hour, hour and a half?
Hour and a half, roughly. Yeah.
Okay, thanks.
This reminds me too, our own local congregation in Naperville used your separate guide for having a pastoral ministry associate group in a congregation. So I suppose that's one of the elements of a potential mental health ministry in a congregation is forming a pastoral ministry group to help the minister out.
Yeah.
To reach out to people.
Yeah, the pastoral care program that I actually developed that as a project in seminary, and because I wanted our local congregation that I was in they wanted to develop a pastoral care program, but kind of like Stephen's ministry, with people that would help out folks in the congregation that were having trouble, and I created that, and it wasn't totally focused on mental health issues. It was all kinds of things that people have, pastoral care issues with, and how you run a program. And there are a number of different types of situations that might involve pastoral care. And I tried to create a guide for each one of those. And a couple of them are on mental health issues.
It's a little good reference guide for our local congregation. Thank you for doing that.
Oh, thank you.
Do you have any other questions or comments?
Yeah. At one point during the discussion, you mentioned lack of ability to get appointments with professional counselors. I'm seeing that a lot in our ministry situation here. What's the answer? Or when we're working with someone spiritual, emotional, they clearly need professional help, but they can't.
Boy, that's a hard question. I don't know if there's a really good answer. I guess, maybe engage in peer support before they can get into professional support, because a lot of, that is, if you have peer support in your area, a lot of peer support, people can join support groups and stuff in peer support before they can see that. But yeah, that's hard. That's really hard. Or getting some sort of some alternate mental health help in, some sort of alternate way of getting help that isn't professional mental health care. That's really hard.
Yeah, I guess the follow-up to that is, do you see a model emerging where there's more triage in the mental health care side of things, where they're not, for example, and this, don't take this the wrong way, but they're not spending time talking with therapy with somebody who's stressed out about some relatively minor things, when there's somebody that's experiencing some very significant life-threatening or trauma type issues. And how can we as practitioners in the congregation influence the mental health community to be responsive to those needs?
Yeah, I have not seen that kind of triage. In fact, I've seen sort of the opposite of, people with really serious problems not getting any help, and people that are the worried well are the ones that can afford it, getting the appointments, which is really sad. I mean, that's why I said sometimes the people with the worst problems get the worst care. And that's really sad. And what is it that we can do about it? That is a really good question. And what is it we can do about it?
Chris, I see
one of the things that comes to mind is a lot of those people with very serious problems come to the attention of the ERs and the police and the law enforcement, and
right.
Trying to do some kind of social justice collaboration with police and ER type people in hospitals to beef up the support that people with very severe problems but no benefits or very little financial benefits can access.
Yeah, I know there is a push, at least in our local area, and I think I've heard about it in more broadly, to instead of having the police would be the responders to mental health crisis, to have not a 911 but 988 number, and they would have somebody respond who's mental health professional to respond, and knows how to de-escalate a situation rather than making it worse.
Chris, you had your hand.
Pushing for that kind of thing in your local community would be really a very important thing to do.
I do, yeah. I just wanted to comment on the previous question or two questions ago, that you have to be your own advocates in mental health. And it's also important to know the laws. So I'm in California. I actually work in Contra Costa County, Barbara, next county over from me. Yeah. But in California, at least, if someone's in crisis, the law says that they have the right to see a professional by a healthcare provider within, if it's an emergency, within I think 72 hours, and if it's a not emergency, it's within 10 business days. And my healthcare provider, Kaiser Permanente, which is a large healthcare provider in the West Coast, has notoriously not been abiding by those. And I actually had to call for an appointment the other day, and I had to go up the chain of command. I said, no, you guys will get me an appointment in 10 days, or I will file a complaint against the state, with the state. So you have to be your own advocate. And it's sad. I do think money is a piece of it, but I think more than anything, it's knowing your rights under state and federal laws. There's a movement to mental health parity to try to equalize, the mental health issues related to physical health Also on that last point, 988, that, will not take effect until July of 2022. So rollout. So that is something that is planned, but at this point, that is not a number that is currently in operation in many places across the country.
Thank you.
I wanted to mention, oh my, what's it called? Some years ago, I took a workshop, and it's called Mental Health First Aid.
Yeah.
And I wondered if anyone's had experience with it. It was helpful at the time, and it would be a good review for me. Just how to respond as a non-professional when encountering somebody who may be going through a crisis.
Right.
We had it taught at our congregation, actually. It's very good, but like a lot of training, I think we need refresher training, because there's just a lot of information to try to remember, and we can't. So
Yeah.
I recommend it as necessary, but not sufficient.
I'm definitely, I'm actually an instructor for mental health first aid. So yes, I totally agree. Yes, it is very good, especially for individuals who may have never have any type of knowledge or information about mental health. But the refresher definitely is needed and beneficial.
Yeah, we've also taught QPR at our congregation, and same thing, some refresher training. That's the suicide prevention: question, persuade, refer.
Refer, absolutely. Thank you. It's great.
Did you mention the suicide prevention name again?
QPR. And if your local NAMI, I know our McHenry County NAMI administers that training. It's shorter. Mental health first aid, correct me here, but that's like a day-long thing.
It's a day-long training.
About
QPR
5.5 or 6 hours. Yeah.
It's 8 hours. The standard curriculum is 8 hours for mental health first aid training.
Mm-hmm.
And QPR is much shorter.
The online version is 5.5 to 6.5 hours.
And QPR is a couple hours ish. So specifically on suicide prevention.
There's also a 12-hour suicide prevention program called ASSIST, ASSIST, that's very intensive, and it gives you a lot of confidence in dealing with suicidal situations. So I really recommend that as well.
Yeah. Thank you. This was great. This was great feedback. So, Reverend Barbara, I'm so glad. Thank you so much for being with us. This was
My
wonderful.
pleasure. Yeah.
Great presentation. Definitely needed. Thank you guys for your feedback. And I want to take a little bit of time. I know we have probably about 5 minutes. I know this is probably quick, but I would like for us to share if you would like to report out things, maybe I would say trainings or webinars or things that you are doing within your community. If you would like to share, this is a great time to share that information, and website or anything that you have going on within your community that you can share with us. So please take time, and I'll open the floor for that. Would anyone like to share what's going on within your communities?
Well, the local Chicago area Interfaith Mental Health Coalition has been sponsoring about one every month or every 2 months an online seminar on faith and mental health issues. And the next one coming up on the 3rd Tuesday of May is going to be having 4 county local health department representatives talk about the social determinants of health and mental health in their areas, and where the discrepancies are, where faith communities might be able to partner with health departments to improve the mental health status of people in their communities. So it's kind of interesting to just on a regular basis do these topics, and Zoom makes it a lot easier to have people attend these things now.
Very true. And thank you so much for sharing that. Yes, Zoom, even though it's like almost like a Zoom community now, but it makes it worth it and being able to attend. So thank you, Mr. Robert. Thank you for sharing that. That's good information to know. And then Stephanie Gray just shared NAMI North Carolina walks on May 22nd. So if you would like to check them out, www.naminc.org. Thank you, Ms. Stephanie, for sharing. Anyone else? And this is mental health month. So hopefully each one of us are making sure that we are taking care of our personal mental health and being that asset and being in that present person for individuals we may know that may be dealing with a mental health issue or having a mental health challenge. So this was perfect timing for having a webinar like this. So if I wanted to also share too, I know that Mr. Dave, you were sharing, kind of asking the questions about what are like some of those resources. I know I'm in Oklahoma City, Oklahoma, and one of the resources they have is what is called systems of care. I'm not sure if it might be in different states as well. It's when you have a psychologist, a nurse, case manager, peer support specialist to actually work with a person instead of them having to go to a hospital or place of patients. They actually meet with the person in their home. So that's kind of like one resource that we've been using out here. And we also have what is called CIT, which is a crisis intervention training. And I know that's probably nationwide as well. That's one area where we try to really help our law enforcement to kind of get educated so that when there is a situation or a crisis that happens like that, that actually specific CIT officers will come and help de-escalate and help with that process. But so those are just a few things to think about. But I know every state is so different, but you can learn so much from each other too. So thank you for asking. That was a really great question too, Dave. Thank you. Well, if anyone else have anything to add or share? Well, I just want to thank you all so much for being here. Like I said, my name is Cody Pollard. I'm a Pathway Associate with Pathways to Promise. And I am just glad that you all were able to be with us this morning. Please, this will be shared on the Pathways to Promise website. So you'll just go to www.pathwaystopromise, and that's a 2, promise.org. And all you have to do is click on the P2P webinars, and this webinar will be listed on there along with others. I know we're having some technical difficulties posting some of our webinars, so if there was one you went to before, that's going to be on there as well. So I just want to thank you all so much. You guys have been great, and I hope that whatever you all have to do for the rest of the week, I hope that you'll be productive and that you will have joy and that you will be effective in what you do. So thank you all so much, and y'all have a wonderful, wonderful day, okay?